Listen, I'm gonna say something that might shock you. The weight loss drug industry, Ozempic, Wegovy, Mounjaro, Zepbound, might quietly be one of the biggest wealth opportunities in the next decade. And this is not coming from TikTok doctors or gym bros who say just eat less and pray more. This is coming from actual Wall Street analysts who literally get paid 7 figures to stare at spreadsheets all day. JP Morgan, Goldman Sachs, Morgan Stanley. These big banks are projecting that the weight loss drug market could grow from around $15 billion today to over $100 billion to $150 billion a year in the next 10 to 15 years. And the wild part, a lot of people still think this is a fad. Bro, if this is a fad, it's the most profitable fad I've ever seen. But here's the twist. This video is not about telling you to go buy Eli Lilly or Novo Nordisk. Those boys already ran like they drank 3 scoops of pre-workout. This video is about the sleeper companies behind the scenes, the picks and shovels, companies that could scale as this entire industry blows up. If you're a regular person with kids, bills, rent, and a dream, this might be one of the long-term opportunities you at least want to understand. So you're not watching from the sidelines again like you did with Apple, Amazon, and Nvidia. And before we go further, this video is not medical advice, this is not fitness advice, and this is not financial advice. This is the financial Watchman, baby. We're just walking through opportunities so you can make smarter decisions. So let's talk about the problem. Obesity is a multi-trillion-dollar drag. Let's zoom out. Worldwide, obesity isn't just a health crisis. It's an economic earthquake. Nearly 900 million people already live with obesity. The World Health Organization expects 1 to 2 billion by 2030. And obesity is projected to cost the global economy $2.76 trillion by 2050. And that comes with loss of productivity, medical bills, diabetes care, heart disease, you name it. And that number isn't coming from, my cousin said. That's coming from the global health organizations and economic projections. So let's think like investors for a second. When you see a multi-trillion-dollar problem, you're looking at a multi-trillion-dollar opportunity for whoever can solve it or improve it even a little bit. That's why the world is paying attention to GLP-1 drugs. Okay, so let's look into the demand. Is it real or just hype? Let's talk numbers, starting with Eli Lilly. Tirzepatide, the drug behind Mounjaro and Zepbound, it recently became the world's best-selling drug. In 1 quarter alone, it generated over $10 billion in sales. So Lilly's total revenue for that quarter, up 54% year over year. Next, we have Novo Nordisk. Wegovy alone brought in $8.4 billion last year. The whole semaglutide franchise, Ozempic and Wegovy, did around $29 billion. These numbers aren't maybe they will be big. These numbers are this is big right now. And here's where it gets crazy. According to market research, the global GLP-1 market is expected to grow from about $13.8 billion in 2024 to $48.8 billion by 2030, just for weight loss drugs. And when you combine diabetes plus weight loss GLP-1s, the market could hit $150 billion within the next 10 to 15 years. And remember, this is with less than 10% of eligible patients having access by 2030. That's not saturation, that's early. Okay, so let's talk about the analyst projections. Here are the receipts. JP Morgan is projecting over $100 billion in GLP-1 market by 2030. Goldman Sachs is projecting $95 billion in the obesity drug market by 2030. Morgan Stanley, $150 billion in the obesity drug market by 2035. And according to the World Health Organization, GLP-1s are officially recommended as part of long-term obesity management. So for my financial watchmen who love simplicity, if an industry is projected to grow 10x in a decade, and it solves a multi-trillion-dollar global problem, and the 2 largest companies can't even meet demand yet, it usually creates generational investment opportunities somewhere in the ecosystem. But hold up, if you're getting value so far, do me a favor, hit that like button so YouTube stops hiding financial education and actually pushes this to people who need it. Alright, let's cook. So what's the elephant in the room? Lawsuits. Of course there are lawsuits. Gastroparesis, stomach paralysis, GI issues, visual problems. People are filing claims. But right now, there are no major settlements, no FDA black box warnings, no regulatory shutdown. The World Health Organization is still recommending GLP-1s, and analysts are still projecting huge growth despite lawsuits. So what does this tell us? The lawsuits create volatility, not a doomsday scenario. As investors, we don't ignore this. We just put it into perspective. Are Eli Lilly and Novo Nordisk already priced for perfection? Let's keep it real. Eli Lilly and Novo Nordisk have been on absolute heaters. Their stock charts look like the before and after of someone who actually stuck to their New Year's resolution. They may keep growing, but a lot of the hype is already baked in. So the bigger question is, where are the sleeper companies that scale quietly in the background as GLP-1 volume explodes? Welcome to the picks and the shovels section. These are the companies with real compounding potential tied to industry growth, not hype. Number 1, the Stevanato Group, ticker symbol STVN. They make the drug delivery pens and cartridges used for GLP-1 injections. And why does it matter? I'm glad you asked. More GLP-1 demands equals more pens equals more Stevanato revenue. This is a real sleeper, under-owned and not mainstream yet. If GLP-1 demand triples, guess what else triples? Pen volume. Number 2, Catalent, ticker symbol CTLT. They're a contracted manufacturer for biologics. Lilly and Novo can't produce enough supplies themselves. They need outside manufacturers. Catalent had some operational struggles, so Wall Street discounted them. But now they are restructuring and positioned for long-term GLP-1 manufacturing contracts. This is a classic turnaround sleeper with real upside. Unfortunately, they were already acquired by Novo Holdings in 2024, so they're no longer available on the public market at this time. Number 3, LZAGY or Lonza Group, ticker symbol LZAGY. They're in the business of high-end biologics manufacturing. GLP-1 drugs are complex biologics, not easy to mass produce. Lonza is one of the few companies on earth capable of producing at massive scale. If GLP-1 hits $100 billion to $150 billion, Lonza's revenue growth is almost unavoidable. This is a long-term infrastructure compounder. Number 4, Americold, ticker symbol COLD. They provide cold storage for pharmaceuticals. These drugs must be refrigerated during transport. More drug volume equals more cold storage and logistics equals more Americold capacity. This one is sneaky. It's not priced for GLP-1 growth at all, but it benefits directly. A true sleeper, quiet but powerful. Let's talk about the other beneficiaries. They're not sleepers, but they're worth knowing. West Pharmaceutical, ticker symbol WST. They make the components like stoppers, seals, vials. The mission is critical but well known. There's also IQVIA, ticker symbol IQV. They provide data plus clinical trial infrastructure. They'll also profit as GLP-1 drugs expand into sleep apnea, fatty liver, heart disease. We also have Macassin, ticker symbol MCK. They distribute almost every GLP-1 to pharmacies. It's slow but a steady compounder. These are not secret gems, but they are legitimate long-term beneficiaries. So looking into the 10 to 15 year window, why does this trend look durable? Because GLP-1 drugs are expanding into sleep apnea, cardiovascular disease, kidney disease, fatty liver disease, and even addiction therapy research. Add pill versions, global expansions, and manufacturing ramp-ups through 2028 to 2030, and suddenly the long-term 10 to 15 year runway looks very real. We're early, not day one, but definitely not late. So here's the final message to you. I'm not telling you to invest in anything. Let's make that clear. I'm simply showing you what the data says, what the analysts project, and which companies may benefit from a multi-decade trend. Whether you invest or not, you now understand an industry that could reshape healthcare and possibly create wealth for companies supporting it. My job is simple: give you the information, break it down with humor and common sense, and let you make the call. That's the financial Watchman way. This video is for informational and entertainment purposes only. Nothing here is financial advice, medical advice, or fitness advice. Always do your own research and make decisions based on your personal financial situation. I am the financial Watchman, and I'm signing out. Bye-bye, y'all.